Lavina, are we live?
Yes, sir, you're live.
Yeah, Kalyani, please start.
Yeah, good evening, everyone. Today we have the live panel discussion, which is one of its kind at this moment. Starting with Professor Suptendranath Sarvadhikari, sir, who did his MBBS, PhD, FIHSI, FIMER Fellow, Distinguished Fellow at HIT Lab, a physician and health informatics educationist, regarded as a pioneer in spreading awareness of health informatics and digital health in India. He is currently the professor and head Department of Digital Research at Shantiniketan Medical College, India, and a global expert roster for digital health, World Health Organization. He is a fellow of the International Academy of Health Sciences and Informatics. He is the advisor in the Center for Digital Healthcare Technologies of Macau, West Bengal, and he is a visiting professor in multiple institutions in India and abroad. He is a distinguished fellow at HIDLAB, and I am a honorary professor. He is a founder member of HL7 FHIR Foundation, and he has been a member of the board of Ghana Health City University College of Medicine at St. Lucia. He has been the dean and professor in the International Institute of Health Management Research, Delhi. Coming to our second panelist, Dr. Madhavulu Buchineni. The sir has been the senior medical safety advisor at IQVIA, provider of biopharmaceutical development for a span of 2 years. He has demonstrated the history of working in a tertiary care teaching hospital and the healthcare university. He is skilled in family practice, diabetic care, palliative care medicine, healthcare, and clinical research. He is known for his strong healthcare services, professional with MD focused in pharmacology and therapeutics from Andhra Medical College, Visakhapatnam. Over to you, Kiran.
Kiran, please unmute yourself.
Lekha, are you available?
Yes, ma'am. Should I go ahead?
Yeah.
Hello, everybody. I would like to introduce the third panelist for tonight. It's Dr. Ravi Teja Khitawat. Hello, sir. And he's graduated from the Andhra Medical College and is currently an assistant professor in emergency medicine at the Government Medical College in Srikakulam, Andhra Pradesh. He has pursued his master's in the field of emergency medicine, and he has also qualified the AMCSSC and is a National Emergency Medicine awardee. And he freelances as a flight physician, and he's also acquired the FACE fellowship. And he's currently pursuing MBA in hospital administration at MRCEM UK. It's a delight to have you, sir. Thank you. Moving on to the fourth panelist, Dr. Narsimha Manoj Turlapati. Good evening, sir. Dr. Turlapati is an alumnus of KIMS and RF, and soon after his undergraduation, he also cleared the AFMS SSC Mumbai board recruitment in order to join the Army Medical Corps, but instead he opted to join the government of Andhra Pradesh as a state medical officer for infant and maternal mortality control. And his work currently is mainly focused on improving the overall neonatal and infant mortality rates. And he has also collaborated in order to identify, summarize, and establish guidelines and action plans by conducting and attending regular state level review meetings with Principal Secretary of Health of the government of Andhra Pradesh and other state level officials and stakeholders. He is currently a public health physician, and he mainly focuses on issues that concern women, children, and families. It deals with basically the problems they have in order to access prenatal and well child care and infant and maternal mortality prevention. He has been working as in this field of public health for the past 5 years and has done a wonderful job at not just at the state but also at the national level. And he's been awarded the Certificate of Excellence for Lead Innovation 2021 by the Director General of WHO Geneva. Moving on to the last panelist for tonight, Dr. Anup Shahji. Good evening, sir. He is definitely the last but not the least. Dr. Anup Shahji is this BDS graduate from Trivandrum, Kerala, and he is currently a final year postgraduate scholar who is pursuing his master's in biomedical engineering at IIT Bombay. And he is currently working on this amazing cancer theranostic system that he is developing, hopefully at the Nanobios lab at IIT Bombay. And it also forms a part of his final year project. And it's because of his immense sincerity and interest in this field that has always helped him receive a lot of recognition and a lot of awards, not just at the national level, but also internationally, because he was featured as one of the top 75 inspiring Indian dentists by Socialent for his unconventional and path-breaking journey. And he's right here motivating all of us, the coming generation of doctors and dentists, to excel. And he was also the only dental student who was selected from among 160 students from various UG streams from all over the country at this Nobel Prize Series event, which was in connection with the Vibrant Gujarat 2017. And that event was presided by 9 Nobel laureates and also the Prime Minister of India. And Dr. Shahji was invited as a delegate over there for his brain cancer treatment project. And he was also awarded the All India First Rank in Scientific Poster Competition during the 70th Indian Dental Conference in the year 2017, which was held in Mumbai, for developing an efficacious microfluidic electromagnetotaxic system, which is not just cost effective apparently, but it's also a lesser intensive method of acquiring liquid biopsies in order to detect cancers without microscopic invasion. And he was also the youngest international speaker to be invited for the annually conducted International Health Tech Innovators Conference called InnoHealth in the year 2018, where he also presided the event. And he's this regular national level speaker. He's a great orator, and that is the reason why he's been invited to a lot of TED Talks and a lot of events from various organizations. Thank you so much. Sai Kiran, we can't
hear you. Still not audible.
Am I?
Yeah, just am I was audible.
Am I audible now, sir?
Now it's okay.
We are extremely honored to have you, everyone, to make us realize there are different career opportunities apart from the normal MD degree. We are extremely honored to have you all, sir. Let me start with the panel discussion with the Honorary Professor Dr. Saptan. So first question, what was the driving force for choosing digital health and health informatics as your career option? And also as an undergraduate, could you explain me what actually digital health and health informatics is?
I think, thanks, Sai. I think that's a pretty long question. Too many questions combined in one. But then let me speak the way I feel. Please excuse my voice. I'm having a sore throat, and that's unfortunate. But then you have to do with my cracking voice. It was during my internship, just after MBBS, I actually read a story about Professor Ralph R. Grams. He was at the University of Gainesville in Florida at that time. He was actually involved in the telemedicine program for NASA in space. So I had actually even written a mail to him, and that time it was pre-internet era. It would be say pre-internet, but pre-common email era. So I had to send a snail mail, and of course I got a reply. And then he was quite encouraging. Then he said that, why don't you come over to the US But then when I looked at the universities in the US, they were all expecting us to have basic idea about computers, which we had absolutely none. So I was thinking at that time, should I enroll in NIIT and get a basic idea how to go ahead? That time, fortunately, I saw within a year, there was an advertisement from the then ITBHU, now it's IITBHU. They were offering PhD in biomedical engineering, and MBBS graduates with certain cutoff marks were eligible. So in 91, I actually applied for it and luckily got the chance. So I joined in the PhD program for biomedical informatics in October 91. And fortunately, I could also complete it in 3 years. So that incidentally was the PhD in biomedical engineering, because at that point of time, there was no informatics in India, not even bioinformatics. In fact, biotechnology was just coming up, but these were entirely new fields. Immediately after coming out, actually, I had written a guest editorial for the Journal of the Indian Medical Association. It's there in PubMed. It was in May 1995. That's 27 years back, almost 3 decades now. And the title is Medical Informatics, Are the Doctors Ready? Unfortunately, the answer is still not a resounding yes. But I've stuck to it. So in the process, I've gone through many phases. I've been a faculty with the School of Medical Science and Technology in IIT Kharagpur. I've been a faculty with the Manipal group, the Amrita group, the PSG group. I was a visiting professor in health informatics for a couple of years. And then I was fortunate to be the first project director for the Center for Health Informatics under the Ministry of Health and Family Welfare in New Delhi. And we started the e-health activities for the government of India, one of which was the National Health Portal. I was the project director for that. That is nhp.gov.in. And subsequently, I came back to academics. I'm still there in teaching post because that's what I love the most. But it's been a long journey, a topsy-turvy journey, as I said, nearing 3 decades. And probably now the things are shaping up better. And definitely the COVID-19 pandemic, one of the plus signs of it has been that the adoption is happening quickly. Coming back to the terminologies, initially it was more of medical informatics. Then we went into health informatics, biomedical or health informatics. Sorry. The nomenclature goes on changing. So what happened in 2019, the World Health Organization formed a division of digital health. So that's a year before the pandemic, really. And they came out with a document, a strategy document, Global Strategy on Digital Health, 2020 to 2025. So where digital health has been very crisply defined as the application of digital technologies. And digital technologies here is something which earlier used to be called ICT, more of information and communications technologies, but now digital technology is shorter and sweeter term. So application, it's a field of knowledge and practice where digital technologies can be applied to improve health. The definition is very simple, but it's very overarching. It's a huge umbrella. So within digital health, I mean, you can say health informatics is a tool. Informatics, if I put it simply, is the art and science of processing information. So when it's applied to health, that's health informatics. Health informatics is a superset which has health information technology or health IT and health information management. Health IT deals with more of the tools, the software, hardware, network, so on. Whereas health information management deals with the documents, governance, codes, and so on. Sorry again. So it's really overcome. So you can put it, the digital health is an overarching umbrella. Health informatics is the tools and management portion of it. And it's inherently an interdisciplinary field where people from all the backgrounds, healthcare, as well as technology, information sciences, cognitive sciences, mathematics, chemistry, everyone has to come together to really make it useful. Thank you.
Thank you, sir. Thank you so much.
Dr. Madhavlu, I would like to. Hello, sir.
Yeah, Lekha, thank you. Apologies, my video is not working. I've been trying for the past 30 minutes. Is it okay with audio?
Yeah, sir, that's okay.
Yeah. Thanks a lot for introducing to this forum and all. Yeah, please.
Thank you, sir. So, sir, my first question to you would be similar. what was your motivation to join the pharmaceutical industry?
Yeah. Actually, honestly speaking, anybody wants to become a doctor. Everybody wants to become a doctor, and they wanted to treat the patient. Nobody wants to be a professor of anatomy. I'm not deteriorating or something and all. So I'm not taking any branch and all. Nobody wants to become any pharmaceutical physician and all. Everybody wants to become. For example, if you take if somebody get a rank and all, so they say that they want to become a cardiologist or neurologist. Nobody wants to say that they're pharmacologist, anatomist, physiologist, or something like that. So the point is, here I'm basically it was my choice of becoming a pharmacologist, and added to that, I have done a family medicine from CMC Vellore, and I have done diabetology as well as, and I've been practicing all these things for the past 15 years. So added to that, I was a pure academician. But during COVID time, what happened, because of that I don't want to discuss all those practical issues. So because of this COVID crunch and all, I have to be forced to move to pharma industry, because I have a lot of friends in that sector as well. So I had a long desire. I mean, I just wanted to explore that area also. So I already explored as an academician and as well as a clinician, but I wanted to see the how the life in a pharma industry as a physician. So for that sake, I went into that, and right now I'm not in that industry. I'm I'm back to academics now, but I have enough experience so that I can able to guide anyone, even a fresher or experienced people, the post MBBS, anybody wanted to come to pharma side, I can give my feedback.
Thank you, sir.
You got the answer or anything else?
I did. Thank you so much for answering.
Yeah,
Thank you.
thank you.
Kalyani ma'am.
Am I audible?
Yes, ma'am, you are.
Yeah, Dr. Raviteja, sir, I wanted to ask you, like, what has motivated you to join into AMCS?
Hello everyone, thank you for having me here. So the motivation, basically the human ego is like, if you have chances, you won't try to go that way. If you don't have chances, you want to go that way. So it started when I'm in school, when I'm in 7th class. I'm very short at that time. During that, my PT teacher started NCC program. So I want to get enrolled in, but he rejected me because I'm very short. I'm 4'7" at that time. So that goal of being with my friends or into that NCC or into that uniforms have left in me like that. In MBBS, I am lucky to have a separate unit in my college, Andhra Medical College. That is the only naval medical unit in the whole country. So slowly I get into the NCC. So then my height was 5'6". So I get into NCC. So slowly with my activities, I got to have that captain position with my things and all. And I am the first captain who sent the cadets, medical cadets, to national camps, because the unit is having several engineering colleges and degree colleges also. They don't used to care about more about medicos, because these are very sophisticated children. They won't come to camps. They won't do the vigorous drills and all, so they don't used to care us. But I took the cadets from my classes and my seniors and juniors who are very much motivated, and I sent them to national trekking camps, national hill climbing camps and all. So with that my motivation came, and my big motivator is surgeon commander Dr. Vijay Kumar. He is also a doctor. He is graduated from Rangaraya Medical College, and he is our captain NCC officer at that time during when I'm doing NCC. Now he is at a position that he is the head of all the doctors in the Navy in all of the India. And recently there was a presidential fleet review this year in Visakhapatnam. It happened. He is the main organizing member of that one. So I'm got motivated by that. Like after MBBS also we can go into Army, Navy and Air Force and we can serve the country like that. So I got motivated in that way.
So actually, what is the process or the procedure to get into AMCS?
Preliminary category is you have to clear the MBBS, only MBBS degree and the house surgeon completion certificate with a state registration number is a main credibility point. And you have to go into online and search. The online link will be posted down. It is AMC SSC entry, Army Medical Corps Short Service Commission entry. If you go into that link and if you continuously see at least for a week, if you open, there will be interviews at different places, most commonly in the Delhi, Bangalore, Calcutta, and also Hyderabad. So at each and every place, the interviews will be happening for every 4 to 6 months. First, you have to apply for the interview. After application, if your qualification and your basic degree, everything matches, they'll call for an interview. You have to attend physically then.
Thank you, sir. Thank you so much. Our next panelist, Dr. Narasimha Manoj, sir. Very good evening, sir. Sir, what was actually your driving force behind joining the World Health Organization? Like, why World Health Organization? Sir, you're not clear, sir. Sir, we have a problem with your audio, sir. Could you please check, sir? Sir, I'm sorry, sir. You're still not clear. Could you please check, sir?
Sir, can you please directly connect with the laptop? That Bluetooth mic might not be working properly. We cannot hear you.
Yes. So am I better now? Is this working fine?
Yes, sir. Yes, sir.
Yes. Apologies for that. So first of all, many thanks for having me on this panel today for this discussion. And also very good evening to all the co-delegates who are joining along with side. So having spoken of the driving motivation behind me to get into WHO is a little jiffy story behind it. Always back then in my internship days, I used to think that like some of my co-panelists said, becoming a physician is treating people. So I used to have this thought that getting into obs gynae would make me treat 2 people at the same point of time. Soon after my internship, after having the experiences of various specialties, I realized that community medicine actually plays a much bigger magnum role. Probably making a program or an intervention plan would try to help a community at a larger scale rather than treating a particular person or an individual. So alongside, I was fortunate enough to have my uncle who always been a motivational force behind me so as to get into medicine, to become a public health physician, who has been working as a national consultant and also as a WHO expert for a technical advisory group, Dr. T.L. Prasad. So that was one of the main motivation which led me into the World Health Organization. And even before getting into World Health Organization, I worked at the state level as a state medical officer, which is again another important factor which actually drove me to the World Health Organization. So even before that, probably the young minds, like the other co-delegates have been saying, probably most of the young minds will not be interested in a non-clinical specialty. When commonly posted this question to interns or the young final year students, probably what specialty you want to go on, you will never hear somebody saying, I want to become a public health physician, or I want to become the pharmacologist or the anatomist or so on. But probably the academic style is not blaming on any particular entity, but we are not giving priority to the basic sciences and the paraclinical sciences as much as they are important. So that is the core driving force behind it. Thank you.
Thank you, sir. Thank you so much. Rekha?
I will be asking a similar question to you, Dr. Anup Shahji. What was it that motivated you to pursue biomedical engineering after BBS?
Hi, hope I'm audible. A very good evening to all the panel members and delegates. Thank you for having me on the panel. Coming back to the question, I've always been interested in research from a very young age, maybe from my class 6 and class 8. It stemmed from the fact that I lost one of my dear family members due to cancer uh, at that time, at my formative years. So I really wanted to understand, okay, what exactly is cancer and what drives cancer? How can you cure cancer? I understood that there is no cure for cancer. A lot of research has been happening upon. So I really wanted to understand, okay, what if I choose this as a career option? I wanted to pursue a clinical degree, first of all. Then I wanted to work on something like a research kind of a thing. So that's why my first motivation was to get into a clinical degree. So I managed to crack the All India NEET exam and the Kerala Medical Entrance Examination. So I got a merit seat in a place called Kasaragod, Kerala. So I finished my undergrad. So after my undergrad, my thought process was very clear. I wanted to get into medical engineering or something related to research, like Professor Subtan sir said. Just like Professor Subtan sir said, I was very interested. It was very clear. I had a clear thought of what I wanted to do. So I applied to different IITs, NITs, ISERs. So my primary goal was to get into a medical engineering for my master's or a direct PhD. So I managed to get into IIT Bombay. So the first 1 year was, I would say, life-changing. I got exposed to mathematics, coding, electronics, and various other engineering domains. So what I've understood from this 1 years of experience is that there is a lot of scope for, especially clinicians from medical background, MBBS, BDS, BAMS to come and take part in research happening here. All the institutions in India, they're severely lacking in clinicians. So most of the medical research people, they all are the engineers who are doing these kind of research. So I've understood that there's a lot of things that the clinicians can take part. And for my final year project, it's the same thing. Like I was interested in cancer research. So currently I'm working on a oral cancer diagnostic system using liposome nanoparticles, which can be used for therapeutics as well as to track where the drug is going in the different tissues of the body. So I'm working in NanoBio's lab under Professor Rohit Srivastava sir, who is also one of the only engineers in the whole country to be member of the National Academy of Medical Sciences. So this is the journey so far.
Thank you so much for the answer, sir. That was brilliant, honestly. Sai Kiran, moving on to you.
Thank you, sir. Sir, we come back to Dr. Subtan sir. So the next question is, what actually is the scope of digital health and health informatics in India when compared to the other countries like abroad, when we say US or UK? Like, what is the scope of digital health and health informatics in India?
Yeah, I think that's a very pertinent question. I think just a few points of reference. If you look at the COVID vaccination program, the way India has done, India has actually been a leader in the world. This many people may not agree, and people think that, oh, we are so lagging behind everything. But that's not the case. If you look at the COVID dashboard, the sort of information it retrieves from multiple information systems, not just one or two databases, and you can get it at the first screenshot itself. That's a marvel. If you look at the amount of, I'm not going into the details of what's gone into it, but that's really something that digital health India is doing rather well, and in fact, much better than many well-known countries, the top countries of the world, so to say. So that we can't do anything is not entirely true. Yes, there are problems. So we have the Ayushman Bharat digital mission that's coming up in a big way, and they're trying to have a unified health interface. So if you are looking at careers, you can just look at the abdm.gov.in/careers section. If you go there, you'll see almost anytime and every time there are 40, 50 posts being advertised, and many people from diverse backgrounds would be required there. I repeat, digital health is not for doctors or engineers alone. It is a teamwork. You'll need people from multiple backgrounds. So the biggest skill that would be required is how to work well in a team. That's a challenge, but that's where the success also lies. So yes, the COVID-19 pandemic, as I said, that has been the silver lining of this pandemic, that digital adoption has gone up. So telemedicine consultations also went up more than 500 or 600% during the pandemic. Of course, it's now come down, but it's still much higher than what it was before. We have this remote patient monitoring and even telehome care in many places. Of course, there are hurdles because insurance doesn't cover those home care things yet. Although telemedicine consultation has been included by IRDAI. So opportunities are definitely increasing. Another thing which has happened legally, I mean, there's been a bill passed in last year, 2021, forming the National Commission for Allied Health Professionals. That is, of course, yet to be formed, but it will be formed very soon. And within this National Commission for Allied Health Professions, there are 10 national councils, of which the 10th is the National Council for Health Information Management and Health Informatic Professionals. So that's definitely going to give a clear-cut guideline and career pathway, because we had been involved with the development of the curriculum for this health and information management, and I was with the Minister of Health and Family Welfare during 2015-16. So it's taking a long time, but it's on the anvil, it's on the process, and definitely more and more career options will come up. And of course, healthcare professionals will have a big role to play. The other thing which is happening is people are actually getting aware. And like you have been able to get a diverse panel here, I think each of us probably represents a small facet of the huge opportunities getting created every day. So I think keep and watch, keep a tab, use Google judiciously.
Thank you, sir. Thank you so much. Lekha.
Dr. Guchaneni, it's your turn to answer another question of mine.
Yeah, yes, Lekha, please.
My next question to you would be, what is the procedure that one must follow to enter the pharmaceutical industry?
Yeah, actually, their criteria is they need a MBBS doctor, actually. So you need to have MBBS degree along with 2 years of, minimum 2 years of clinical practice. That is a mandatory. So along with that, the 2 years of clinical practice with MBBS degree is enough as a fresher to get into the pharma industry as a pharmaceutical physician. Else, if you have a 2 years of pharmacovigilance experience along with the 2 years of clinical practice, that will be added benefit. So that's all. Like it's not like MBBS people only can get into this pharma industry as a medical advisor and all. Even dentist, even PharmD, these people also, they're all in the loop line and all. So this is the criteria of joining, nothing else. But if you have MD, that is an additional benefit. MD of not only of pharmacology, doesn't mean that MD pharmacology people are chosen for the pharma industry. It's not like that. The clinicians, even the surgeons, even the gynecologists, dermatologists, so general surgeons, anesthetists. There's a wide variety of clinicians. Those who wanted to opt this particular field, they're opting because of so many reasons in metros. Particularly in COVID, the many super specialists, even the broad specialist and super specialist, even the clinicians, they opted to the pharma industry because of work from home facility. Have I answered your question? Or
Yeah, I just have another small question.
Yes, please.
You said 2 years of clinical experience or 2 years of pharmacovigilance period, right?
No. 2 years of clinical practice is a must.
Okay. That with MBBS or your undergrad?
Yes. Freshers directly they'll not be taking. Yeah, thank you.
Okay, thank you, sir. Kalyani.
Raviteja, sir, this question is for you. As you have mentioned earlier that we have to face an interview to get into MCS, like what type of questions we will be asked, else what questions were you put at the interview?
Basically, it comes like in the undergraduate days, Viva and interview are totally of questions only. But in this kind of interview, as it is conducted by the armed forces, the knowledge thing is only 50% of the grading. It is not objective, it is subjective. The board is with the like 7 to 8 members. In that, only doctors will be consisting of 40%. One general head will be there, and other department persons will be leading that interview. And going to that interview, we have to be dressed up well. They will see the attitude of the person, aptitude of the person, and how well he is behaving with others. From the point you are entering into the hospital or a college, mostly these interviews will be conducted in the army research colleges, like in Bangalore or Delhi, army research hospitals. You will be watched on, like how this person is behaving, like how he is dressed up. But sorry to say this, in most of the classes and all, when you are trying to do something new, when you are trying to read something or pursue something new, our friends will demotivate us. They will tell, okay, you are doing this and that, no need to do this. So don't get those things of comments into your brain. You dress up well. You dress up like you are going to a party, like an official meeting or to a convocation. How will you get dressed up? You should be dressed up well. Because of your dressing, it will carry marks. How you are looking into their eyes, how you are walking into the room, and you have to sit only after they tell you to sit, not before that. And knowledge questions, they'll be asking random questions. There'll be no any set of questions or set of things. I have asked about postpartum hemorrhage. I have said the answers, like how will you control, what are the steps of controlling postpartum hemorrhage. And after that, they have asked me about vitamins, mainly about the vitamin C and vitamin D. Actually, they asked me about the what are the name of vitamin D, how the cycle runs. I am very bad at vitamins. I'm stuck at that point, and I said that I don't know. This is the clever answer you should give in the interview. Don't blabber things. Don't do just what you do in the MBBS Viva. You will be immediately rejected. If you don't know, tell that I don't know, sir. I'll get back to it immediately. If you know it, tell that confidently. And if you are blabbering or giving a wrong answer, that means you don't know the answer of this question, and which answer you are telling, that related question also you are not having that enough knowledge. So 2 points you are losing it. So for boys, it's okay to have a tie clip. I personally attended this interview in Delhi. So during my dance coaching, I went in middle of the dance coaching. So it's normal. And my roommate said, "Oh, why are you wearing tie? Can't you go normally and all?" So I wore a tie and went to Delhi. So my uncle is living in Delhi. So he said that, "Oh, where is your tie clip?" I never wore a tie clip until now. I don't use for any function, or just tie is an extra part and tie clip is more than that. He gave me his tie clip, and you should be looking like this in the interview. So don't be hesitate to look good in the interview. And for the girls, y- to look confident, I am not degrading chudidars and all, but to look confident, you can go with an overcoat, shirt, pant, shoes. Shoes are a must. Not, they won't be written anywhere that you should wear shoes. Shoes will give an impression that you are like confident, like not. For girls, overcoat and dressed up, and these things will be good. And interview questions, if you know, just answer. Otherwise, you just skip it off. Interview will be of two parts. One thing is the this knowledge part. In this knowledge part, in my interview, like 200 people have been selected, and in the 200 people, only 14 members have passed this interview. These 14 persons will be scheduled for a physical exam for the next day. Physical exam comprises of everything, like your height, weight, how can you hear, like what is your vision. They'll do an x-ray, they'll strip you off completely and do an examination. They will take the blood, urine samples, and they'll test properly before joining. And this, in this medical exam, out of 14, 5 members got rejected. People don't know that they are having problems. Like some people got not selected because of their cylindrical vision. which they don't know. Some people got deselected due to their knock knees, which they don't know. So totally 9 people out of 200 are selected. And these people, if there are some minor corrections like weight, like the person is 2 kgs above or 2 kgs below, they will give time. Within these 2 months, you will get an offer letter. You try to decrease, or otherwise you won't be selected. So in that aspect also, they'll consider. And you can come back home and you will get the offer letter in the mail. This is how the interview will go.
Thank you, sir.
Yes, sir. My next question is to Dr. Narasimha Manoj, sir, once again. Sir. Sir, we are sorry, we are not able. Sir, am I audible, sir?
Please go ahead.
So, like, what is your process and procedure to get into World Health Organization position after MBBS? Like, what are the requirements and what is the actual process of getting into it?
Even before I start with the technical process and procedure, I believe that all young graduates should post this question to themselves, like what exactly they want to have as a career goal or an aspiration, because that plays a very prominent impact in where we actually want to go as a career pathway. Let it be World Health Organization or the other UN bodies, or going into the academics side, or being a clinician. It is very prudent to have a self-assessment after the undergraduate phase, at least, because most commonly at a BPC level, after the intermediate, we are driven towards MBBS as a fundamental option, even though we have several other career options. And after MBBS, we are all in a kind of a groove that we either pursue an MD or an MS right after an MBBS. So just take a little breather after your MBBS during an internship phase. And I suppose this comes in handy as a suggestion. Let us reassess ourselves and put a thought process even before we take up a choice. As coming to your question, the process and procedure behind getting into World Health Organization, definitely there is a scope and chance for fresh young graduates, but then the opportunity is posted in terms of internships rather than directly in a position or a post for young graduates, because try to understand this in a modified way, because the World Health Organization usually works at a national level or at an international level. So of that magnitude, when you want to handle things of such important standards and level, you need to have some basic experience in things and the way the things function and the way the whole process operates in general. So it usually, the posts most often require at least a 1 year or 2 year experience specified to the post you're applying. As in my case, I worked as a national consultant for antenatal care. So even before joining WHO, as I worked for the Andhra Pradesh state government as a state medical officer for maternal and infant mortality, that came in very much handy, because I was part of the state medical board which reviewed infant and maternal mortality situated in Visakhapatnam, also having a regular state level review meetings and assessments. So we were pretty much in the system of how the functionality works and how the governmental affair works on. And having said about WHO's opportunities, it is pretty straightforward. It is an open platform, and there are no restrictions, and there are no reservations, more importantly. It's a website which is open to access for everyone. It's who.int/careers. If you want, I would repeat it again. It's who.int/careers, wherein just on a lighter note, it's more like creating a matrimony profile. You actually make a profile for yourself, stating what your academic qualification is, and what your experience is, if there is any experience as such. And then the match automatically happens. You give your field of choice of interest, let it be in terms of obs-gynae in maternal and child health, or in terms of emergency response, or in terms of general response, so on and so forth. There is a wide scope, neglected tropical diseases, and so on. We can name all. So you just put up all your interests in that profile which you're building up, and then you upload a formal copy of your curriculum vitae. So once the profiles get matched up, you get an email back stating that you've been shortlisted. I'll be a little elaborate in this just as to, because this I believe one of the most intriguing question of how do you end up in WHO as a consultant or as an NPO or other posts. So just to make it more easy to understand for people, I'll have to put this in a little longer span. So you will receive the email from the country office most often, because if you're applying for a country post, it will be the country office, which is located at Delhi, and you'll receive an email which will ask you to attend a written interview, and then followed by an formal interview. So because of the recent times of the COVID pandemic and so on, it's being conducted online virtually, but otherwise it will be an in-person interview at the Delhi office, the country office. So the first set of mail would often be in a very professionally organized way, where you're asked for your time of convenience and when you want to attend the questionnaire and so on. You would receive a questionnaire, and then you have to reply back within the stipulated time. A set of questions will be sent, which will check your technical expertise in the field and the post you have applied. As in my case, it was the antenatal consultant. So you will be posted in hypothetical scenario, like so-and-so is the kind of a situation and the problem, and how do you want to handle this? What would be the strategies to go ahead with this, and such kind of a question. After that, if the questionnaire part is through and clear, then you'll be having an in-person or a virtual interview. Like said, most often the organizations at country level or at international level, like Ketawat sir was saying, a panel of a diverse background will be there. It's not just the physicians, or it's not just the doctors who are in the panel, but people from the HR, people from the psychology, people from other competent backgrounds will be there, so as to assess your formal competencies. So the interview process or the shortlisting or the filtering, which we can say in simpler terms, is pretty much similar to the armed forces. Like sir was saying, I was recollecting my own experience when I attended the Mumbai board. So yeah, rooting back to WHO, that is also very much similar. Your technical expertise is only considered up to 50%, because anyway, if you are having the competent skills, which are more important than anything else, that learning comes automatically, is what WHO believes in. So competencies were also pretty much mentioned there, like the leadership skills or the qualities, or probably you will have how best you go as in a camaraderie and teamwork, or in terms of probably handling a problem issue, the problem solving skills. These kind of things are assessed in a summative way, not just posting like this is the situation and explain how you do, but they'll ask your own life experiences, like have you ever been in such kind of a situation, and how do you kind of come out with a solution for such kind of a situation. All through you were satisfactorily informing and able to please the panel and the board, you will shortly receive an email stating that so-and-so is your position and post, and giving you an offer letter. So I suppose that's pretty much clear and understanding. I'm happy to answer any other questions.
It's very, very clear, sir. Thank you so much. Lekha.
Dr. Shaji, another question for you. So your previous answer pretty much explained what interested you to join biomedical engineering. So is there something, now that you're a part of, like now that you're pursuing it, is there something that you are really fond of, or something that really fascinates you? Maybe you could tell us something about your projects or something.
Yeah, so currently I'm pursuing as a engineering degree. So I'm exposed to different engineering domains. So something that have fascinated me a lot has been medical devices. So in IIT Bombay, to speak of, we work on a lot of medical devices for micronutrient screening, or for pregnancy testing, or for COVID testing. So during the COVID pandemic, our labs have found out different COVID testing protocols, simple ones that you can use in home. So as a clinical engineer level, there are a lot of research happening. So when you look for like, for example, like when you come to this college, you can either be a clinical engineer, like if you're from a clinical background, you can either have aspirations to become a clinical engineer, or you can have an aspiration to become a clinical scientist in the future. That means most of the scientist posts in India that ICMR advertises usually has a PhD requirement. So for a medical graduate, like when I'm speaking about a clinical graduate, could be MBBS, BDS, BAMS, BHMS. So we have a direct PhD program as well. So for like if you're interested in research and clinical aspects of research, then you can directly join for the PhD program directly. So the PhD researchers will be dealing with a lot of broad problems in their 3 to 5 years of tenure. If you're looking just for a 2-year an engineering degree, so you'll be working on short-term problems like 1 year project on like innovating a medical device to detect this kind of disease, or you kind of innovate or you work on a cellular or molecular biology level of problems. So since I am more into clinical research, and since my career ambition is to work as a clinical scientist in the future after PhD and to join academia, so my problem is also like that. So my initial problem that I found for myself as a problem statement was that a lot of people have innate fear for surgery. So I wanted to work on a different alternative technique for treating cancer, where we don't need to go for surgery, where we can have a painless, without using any needles, type of nanotechnology treatment. So that's my current final year project right now. So it's on the process. So we're getting promising results. So we are hoping that we could start our annual trials probably in the next year. So
I mean, the term theranostic is pretty innovative in itself, because it's like therapeutic and diagnostic. So I think that's wonderful. Thank you, sir.
Thank you.
Thank you, sir. Like, we again go back to Dr. Satyan, sir. Sir, like, what is the process of getting into digital health and health informatics course? And what are the challenges one faces in this course throughout?
Courses, particularly India, again, of course, now a lot of courses are coming up. In fact, we had started the first MSc in medical informatics way back in 2005 from Amrita University. But I think that was a bit ahead of time, so it had to be closed down in about 3 years. Like in IIT Kharagpur, there's this MMST program, Masters in Medical Science and Technology. After MBBS, they can go through the entrance and join it. And the course is mostly technology oriented. Most of the students actually prefer to pursue further research abroad. And some of them do come back. In fact, one of the first batch students is now, I think he's an additional professor in IIT Hyderabad. He had done his PhD from Singapore. So things are happening. Right now, the Apollo University in Chittoor, they have started a Masters in Health Informatics and Analytics. Then there's the Mahatma Gandhi University of Medical Science and Technology in Jaipur. They offer certain courses on that. Then, in fact, in the healthcare, there are lots of programs for hospital management, postgraduate diploma in hospital management, and like IIHMR University in Jaipur, IIHMR in Delhi, then Chitkara University in Chandigarh, they offer. And within that, there is usually a stream related to health information management, health information technology. So there are diverse courses, but actually what happens, the field is evolving very fast, changing very fast. So really the things that work and the things that you need to learn on your own, you have to learn on job. And the way I offer the courses wherever, because I'm an adjunct faculty to most of these places, the thing I try to instill is you should learn how to learn. It may sound very simple, not at all. And learning is not just learning new things. First thing is you have to unlearn. We have a lot of wrong concepts accumulating throughout our years of so-called education. So you first must unlearn that, then relearn newer things and go on learning. It's a lifelong learning thing. So this is an ever evolving field. And as I repeat, the COVID-19 pandemic has opened a new horizon, and we should definitely make best use of it. So courses are there. There are many courses. Again, you can do Google. But more important, the courses is whatever course you do, please learn how to learn and how to unlearn. That would be very helpful.
Thank you, sir. Thank you so much. Lekha.
Dr. Guccinini, another question for you.
Yes, Lekha, please.
So we spoke about how to enter the pharmaceutical industry and all of that. So what do you think are the opportunities that one could expect as a pharma clinician, like after having done this? What are the opportunities we could be faced with? What kind?
Actually, there are different designations are there. That depends upon the nature of the work. For example, I'll tell you the different designations in as a pharmaceutical physician. For example, here there are three kinds of jobs. One is of pure desk job, something like you will be into the clinical research and you need to go through the hundreds of documents every day, and it is something like a literature search and documenting. The second kind of work is, it is something like medical safety advisor. In the medical safety advisor, you need to document adverse drug reactions in the clinical trial, if it is active clinical trial, or if it is a post-medical, post-marketing trial. In that, yeah, you need to again report serious adverse drug reactions and the adverse events, whether they are serious or non-serious. And the third type of work is manager medical advisor. Manager medical advisor, what he does is he will be actively involving in new drug launching. For example, if company is launching a new drug, yeah, if non-medical person goes and talks about the drug, the other clinicians might not be in a position to accept it practically, isn't it? So what they do is they will pick up MD pharmacologist or a clinical pharmacologist, DM clinical pharmacologist, such a people, and they will go and arrange a new drug launch, and they will go and meet the key KOL. KOL means key opinion leaders. Key opinion leaders means one particular city or metro, all the top practitioners, they will have a gathering. In that, they will launch a new drug, and there they will talk about the key aspects or the what are all the advantages of the new drug over the already conventional drug available in the market. So this is the nature of work. Other important nature of work here is in pharmaceutical physician is a teaching and training for the medical representatives. You might have seen the medical representatives going to a doctor and explaining the things. So they will train these medical representative people, and this part will be done by this manager medical services. So these are all the different kinds of works in a pharmaceutical physician will do in pharmaceutical company. And other type of work is, you might have seen there are number of apps are coming. For example, 1mg. In that, you can buy the online pharmacy, online drugs and all. In that, you might have seen the drug information brochures. So that drug information will be again edited, and the safety issues will be updated by these kind of doctors. They will be doing this kind of job. So the point is, it is something like they should have a basic medical degree, but they will be involved in these safety issues. And another important thing is criteria to get into this particular pharmaceutical physician is they should be very good at good clinical practice. And they should be good at MEDRA coding. MEDRA coding is nothing but medical dictionary for regulatory activities. If you type MEDRA coding in the Google, it will be automatically, it will be popping up and it leads to the website. And one more thing is you need to be expert in good communication skills and writing skills. Another important thing is typing skills. And finally, it's better to have a good knowledge about how to manage the Excel and basic biostatistics. With all the skills, it's very easy to get into this pharmaceutical field.
So,
So
sir, it would
did I
either
answer?
be,
Huh.
yeah, so it would either be like as a clinical researcher in the field of like drug trials, or it could be where you go and
Yeah,
like
that's
as
what.
a representative.
That depends upon the designation.
Right.
For example, senior medical reviewer. Senior medical reviewer means they will review the lot of documents pertaining to the clinical trial, and they will see all the clinical trial data. They will compare with the case reporting form, and if there is any discrepancy is there, that they will inform to the principal investigator. The principal investigator is the person who supervises the clinical trial site. He might be a specialist or a super specialist, that depending upon the drug they are working on that.
Okay. All right, sir. Thank you so much.
Yeah. You're welcome.
Kalyani ma'am.
Kedawat sir, I have a question for you. Like after getting into AMCS, if we want to pursue a post-graduation, is there any special process for that, or how should we go further?
So the MBBS persons are listening this. In your NEET application, there will be a tick mark if you want to pursue in Army, Armed Forces, Medical Services. If you opt for that, you will be taken into their colleges. That is the first point. This is a way of entry. This is known as civilian entry. So a person who is not into army, but he want to come into armed forces, medical colleges, this is one kind of entry. Anyone can go into their PG, but it is very less chances, because the persons who are selected in this interview, will be pursuing a separate training of 3 to 4 months physical training, and they'll be posted elsewhere. Either they are in army, air force, and navy. So most of the people will get selected into army, 85%, navy 10%, and the top 5, the cream layer of the interview candidates, will be selected for air force. Air force will be a top highest thing, and the air force and the navy people will be positioned in a places where there are airports and ship ports. But the army people who are selected into the army, they'll be 85%, they'll be posted elsewhere. It can be a border of the Pakistan or small villages. You don't know the names of the towns also. They don't even like exist in Google Maps also. Those kind of postings you will get when you are selected into the army. But navy, you will be posted in like Visakhapatnam, Kochi, Mumbai, only the port areas, and the air force also with cities with airports. So other entry is the reservation entry. The reservation entry is only for the people who served in armed forces medical sciences for 5 years. After serving for 5 years, you will get that extra reservation. Many people know only AFMC Pune. People will think that is only the college. No. Armed Forces Medical Services, AFMS, are having 8 colleges around India. In that, post-graduation degree will be only for the persons who did this 5 years of service. So if you are having this 5 years of service category, and if you just qualify an exam, you can take whatever PG seat you want. It's like a piece of cake. I want radiology, I want medicine. You can take any other thing. So after all these candidates are filled up, if there are any left out seats, they will be open to civilians, like who opted to join armed forces medical services. Then these seats, left out seats, maybe 1 or 2%, or completely non-clinical or paraclinical seats will be left out for civilians. So in this both ways, you can do PG in the armed forces medical services.
So we should complete all the 5 complete years at the
Yes.
service, sir?
Complete years. Otherwise, you won't get that category of reservation. So if you complete and you need to just qualify. Even after 1 year of gap, no one remembers anything of MBBS. Will you think after 5 years anyone will remember? And after 5 years, if you are qualifying, you are competing with the other guy who is sitting in your clinic area for the 5 years in that mountain hill. Will you think that he'll secure a top rank like a civilian person? No. So if you just qualify, these 8 medical colleges, all the postgraduate seats are yours. You can take anything you want.
Thank you, sir.
Thank you so much, sir. So my next question is to Dr. Narasimha Manoj, sir, once again.
Go on, Kiran.
Sir, like, how is your work life, sir, as WHO consultant? Like, how is your work life? What are the pressures you face? What are the challenges?
So basically, largely the public health work is kind of classified into two categories at a larger note. Right? It's kind of a desk-based job or it's kind of a field-based job. I do see people from community medicine postings from the undergraduates. Most often they don't like to go out in the field. So if you are hesitant about working out in the field, I'm sorry to say this public health is not a domain where we can sit at some kind of an office setup and work. Certainly that is also an option, but that is only after you garner some kind of a field experience. It's not that we always want to go out and sit in an AC chamber and then simply create policies and strategies. So as to do certain things of such magnitude, you need to have an understanding of the grassroots level problems. So coming to my particular, what you call the position I had and the kind of work style I had, I was a national consultant, like I said. So even though I am a country consultant, I was posted for the state of Tamil Nadu. So I was largely supporting state of Tamil Nadu for its ANC implementation program. That's antenatal care implementation program. So just as to say an update which is coming, we all know that ANC checkups are mandatory for 4 checkups at least during the entire period of pregnancy. I'm happy to share this that I've been a part of the path breaking and changing the latest guidelines, which makes 8 checkups mandatory. So we've been trying to implement that particular program in the states of Tamil Nadu and Assam. So I was the overall in charge for the state of Tamil Nadu. Having said that, most of the WHO positions have a component of extensive travel. That's the foremost thing which I can say. And in terms of travel, the good thing about the UN body organizations is they give utmost priority to their staff. But just because you're asked to travel, you're not permitted to travel after the sunset. So they have their own very stringent rules and regulations to facilitate the benefits of the consultants or the staff they're working with. It's an organization which takes utmost care of the staff they have. It believes in a system that when people are cared well, the best outputs are expected out of them. So they have their regulations. It's expected that you travel about 2 to 3 weeks of the month period, you know. Most of the time, it's either stated at the state's capital or the country's capital, depending on the position you are in, or at the district headquarters. For a surveillance medical officer, it will be a district headquarters. For a state level consultant, it will be a state capital, and for a national consultant, it will either be the state capital or the national capital, which definitely includes a part of a travel component. Like I said, about 2 to 3 weeks, not mandatory. Depending on the need and necessity, you're expected to travel to remote access locations. You might have food, you might not have food, and that there are a certain level of challenges. But then being a part of WHO or any other UN organization, or for that matter, being in public health, needs to have a central element somewhere deep down in your heart that you need to work for the people who are underbenefited or marginalized. You know, when you're actually sitting in a hospital setup as a physician or a clinician, or sitting at a higher metro city, you actually have basically no exposure or idea of the problems that are being faced at a grassroots level. So when we are out open in the community and field, we get a different experience, we get a different understanding that throws an entirely different dimension of the kind of problems we face there, and in terms of health and care. So it's very important to be out in the field, and if being out in the field is considered a problem factor, I strongly believe that it will be a difficult time in public health. Otherwise, apart, it's always the best experience to have been a part of UN organizations.
Thank you so much, sir. Like traveling 2 to 3 weeks. Over to Lekha.
Dr. Sharji, another question for you. So since yours has been such a remarkable and a very unconventional journey from BDS to biomedical engineering, so do you think, sir, that there are like a definite set of steps that a BDS or an MBBS student must follow in order to enter biomedicine later? Or like, what's your take on that?
That's a very good question. So first, for pursuing any career choice, I think that strong thought that I want to do this, or I will be someone if I actually pursue something. So it's more about education should not be about rote learning. It should be about learning some key skills that will be useful for your life and for the people's life that you'll be touching with your education directly or indirectly. So I think if you are like very particular, okay, I want to do biomedical engineering or I want to become a clinical scientist in the future, which deals with technology, or like Professor Sukutan says about digital health, then if you're a clinical grad, I think the first option would be to clear the NEET exam, because most of the institutes in the country uh, demands a national level clearing exam, like a qualifying examination as a preliminary cutoff criteria. So I can say from IIT's point of view, because I've applied to a few IITs after my undergrad. So first initial cutoff will be based on your NEET rank. So if you have a NEET rank or an AIMS rank under 5,000, that's a very safe thing. Then after that, they'll call you for an aptitude exam, which will have topics from class 10th, 11th, and 12th. They'll test you for your fundamentals in physics, chemistry, and biology and mathematics. So once you clear that, they'll call you for multiple rounds of interview. Some institutes might have one round of interview. Some institutes might have double, 2 or 3 more rounds of interview. So once you clear all these criteria, they'll put a merit list. Then accordingly, they'll offer seat. So for different institutes, the number of seats varies. For IIT Bombay, it's around 25 for MTech program. For PhD, they take every cycle around 10 to 12. IIT Delhi has around 12 seats. So it depends on different institutes. So different institutes are known for different things. So if you are into core computational, imaging, physics, medical devices, IIT Delhi and Bombay would be good. Or if you are into something else, different IITs would be good. So I would suggest you to talk to seniors through LinkedIn or through Google, understand which IIT has that specific area of domain that you are particularly interested in. I would suggest more than the institute name, go for the faculty and the lab that is currently working on. So there are a lot of good labs in the country that are doing excellent research. And I'm happy to say that there are a lot of clinicians who have went on to do different engineering degrees or PhDs, and now they have set up their own labs in different IITs. Like there's one professor, Arvind Kumar Enkelser, who was a alumnus of IIT Bombay PhD program. Now he's a faculty in IIT Hyderabad. So there are different examples like this. So I would suggest, like if you're particular about this, this will be your path of, the career option. If you're interested in PhD, like a direct PhD after your MBBS, because MBBS is a 5-year professional degree. So you are directly eligible to apply for a PhD program literally in any university across the country and even abroad. If it is in India, they would require a fellowship exam such as CSIR JRF or ICMR JRF or DBD JRF. These are the national qualifying examination to pursue a PhD with funding. Also, different IITs have their own funding, so you can also apply different IITs with your NEET or AIMS score, like I mentioned before. Then there is a high chance that you might get shortlisted. A lot of institutes are now particular about diverse backgrounds, so they are particular about having clinicians on board for their master's program, PhD programs. So in a class of, I'll give you a rough estimate of how my class looks like. So I'm a batch of 2021 IIT Bombay Master's Program in Biomedical Engineering. My class had 24 students, 23 are engineers, and there is only one doctor. So even though the proportion is less, I think the main problem here is the awareness. A lot of doctors are not aware that there is a program called biomedical engineering. They can actually apply for it. They're actually eligible to apply for it. So I think with more awareness, a lot of clinicians will apply for such programs. There will be better representation in biomedical engineering research from doctors. I think it's a very good field. Like it has high prospects. In India, it's a very niche field. It's a budding field. But due to the various, good efforts from the PM, the Department of Biotechnology, the Department of Science and Technology, SCRB, BIRAC programs, a lot of good research is happening. So there's a big scope in the future for biomedical engineers, especially with someone from a clinical background. So yeah.
So like you need grit and social networking, and along with obviously perseverance, but yeah, that should be it. Okay,
Yeah.
thank you, sir. Sai Kiran.
Thank you so much, sir. Sir, we again come back to Dr. Sukutan, sir. Sir, can we know like your initial journey, like where were you posted initially and how was your career? Like what are the challenges you faced and what advice you wanted to give to us if you wanted to join digital health and health informatics?
Yeah, I think I have already shared a part of it. So initially it was not that easy. In fact, my PhD I got in 1995. But the first job, because of that PhD, I got 7 years later in 2002 when I joined as an assistant professor in the School of Medical Science and Technology in IIT Kharagpur. And subsequently, then I went to Amrita. In Amrita, we started 2 programs. One, as I said, MSc on Medical Informatics. The other was MTech in Biomedical Engineering. Well, the MTech Biomedical Engineering is going on, but the MSc Biomedical Informatics had to be stopped in 3 years because, as I said, probably that was a bit ahead of time. So sometimes being ahead of time may make you feel good, but then probably not many opportunities are there, which you can look at it both ways, the glass half full or half empty. So things, as I said, right now, a lot of things are happening. So I have been in faculty position in all these groups in Amrita. Then, as I said, currently I'm an adjunct faculty in Apollo University, in Chitkara University, in MGU MST Jaipur. So almost all the places where some programs on health informatics or digital health are being offered, I am usually involved either as a adjunct faculty or PhD advisor, guide, or examiner, and so on. So courses are there. Proportionately, jobs are increasing. In fact, initially what happened, even maybe 5 years back, we wouldn't have thought of it. But because of this pandemic, people are now taking digital health seriously. The other market forces, which obviously has increased the spread of digital health, is the wearables, Internet of Things, Internet of Medical Things. So whether it's Fitbit or Apple Watch or whatever, they are having a lot of medical application, which leads to another problem. There is not enough of digital health literacy, or specifically health data literacy. So digital literacy and health data literacy together is digital health literacy, either among the doctors or among the patients. So as an educationist, I think there's a very huge task cut up for capacity building of the human resources for health. And of course, for implementation, change management is the key. Change management, again, it is a multidisciplinary activity. We need to have people from diverse backgrounds. Now, understanding each other's language is not that simple. I mean, I think all of you would have seen that cartoon. One person from one end is saying it's a 6, and the other person is saying from the other end it's 9. And obviously, neither of them is wrong. It's the point of view that matters. So in any interdisciplinary things, this is always going to happen. How do you reconcile? So I repeat, I mean, learning how to learn and working in a team. Being a team member is the key to excel in a career path in digital health.
Thank you, sir. Thank you so much. Hutuleka.
Dr. Buchanani, another question for you, sir.
Yeah, yes, Lekha.
So, sir, what are your opinions on, like, if somebody would want to pursue post-graduation in medicine along with like their interest in pharmacological in this field? So what do you think about that? Should they go?
No, actually, there is no part-time business here.
No, I didn't mean
Actually,
it like
no,
that.
it is something like, I'll tell you, like, honestly, it is a full-time job. Like, if somebody wants to become a software guy, like, we know that we have been in the medical field, and we have been wearing the apron and stethoscope, and I think we are not enjoyed to the fullest like a software guy, isn't it? If somebody has got a passion for that, really, as a plan B, I don't suggest personally as a plan A for this particular field. This you can keep it as a plan B, so that the people who likes to be in working for a pharma industry, there are no pharma industry, many industries, as you know, Dr. Reddy, GSK, and Glasgow, even Cognizant, and there are many contract research organizations. So they can enjoy the fullest level like a software guy. Like being a doctor, if you want to enjoy a software guy like profession or something like that, you can enjoy that. And one more thing, we don't have a time to look at sometimes the personal things also. You need to always carry the laptop. Your back will be always with the laptop. So all your stuff will be replaced with the laptop. So what I mean to say that not everybody will practice, not everybody will become an academician. So there is always a place called plan C or plan B, whatever, like their point of choice. For example, if you take when my ex company and all, many people are doctors, but in the COVID time, they were working like they're doing the discharge. I mean, that they're doing the duties like a homemaker, and they're working as well. So you can understand like the balancing the things and all. So the point is no part-time thing is allowed here, and it is impossible working in a pharmaceutical industry. It is impossible to prepare for a PG. That is for sure, because they don't allow you to. Your brain will be fully occupied with the work. They'll design a work culture such a way that you don't have a time. So you will be craving for Saturday. Yeah. So because I've seen the academics for the 15 years. After that, I came to this pharma industry. So with that experience, I'm quoting. I just wanted to share my experience. So added to that, what I can suggest that those who are preparing for the PG, so don't ideally prepare for PG. You work part-time in a hospital. So maintain that clinical experience. So that clinical experience will be definitely help to getting a job as a pharmaceutical physician. So that is for sure. Hope I think I have answered your question and all.
Your advice would be for somebody like to make up their mind and to
Yeah,
just choose one.
yeah.
Okay.
That's great.
Yes, sir.
Thank you.
Dr. Ketawat, so like after getting into AMCS, what if we want to quit in middle of a tenure? Is there any process or?
I just cut, copy and paste the previous answer. Like if you want to pursue a PG degree in pharmaceuticals, it's very tough. You should be craving for Saturday. And here in this armed forces, medical corps and all, you'll be craving for the next 5 years to come out of it. If you are entering into it, it's a no way out for the 5 years. So you should be prepared initially only. And doctor is a job that you will be having no holiday, and army is a job you will be having no holiday. So in this job you will be having no holidays, double no for holidays. So there will be no time or anything to prepare for a PG. Anything, if you want to discontinue this, it will be hardly possible. It should be like very much life changing decision. Otherwise you can't come out with this AIM short service commission. And after 5 years, your tenure will automatically get over. You will be retired. This is called short service commission because it is only for 5 years. No, if you want to continue, you like the job and you will get promoted after 5 years, you want to continue here, you can apply for a permanent position. And there is a clause, you should be into the permanent position within 32 years of age. So you should join the short service commission before 27 years. After 32, they won't take as a permanent member. So after 5 years, if you want to continue, you can continue for in the short service commission for +2 years and all until maximum 9 years. Otherwise, you want to get a permanent recruitment, you can apply for that also before 32 years of age.
So there is no way to quit before 5 years, sir?
Very much hardly possible.
Dr. Ravi, please correct me if I'm wrong. Like, for example, if somebody wants to give any services for 1 year or 2 years, if they run away from that service, I think the police will catch you. And I think, is it correct, Dr. Ravi?
No, I didn't hear it.
No, is it something like it's, you told it is a 5 years course and somebody has completed 2 years and they run away from the services. They could not able to continue. It's something like absconding. Is it police?
Any person can abscond, but the army people or the police will come to your home, which is registered in your address.
Yeah, that's what I wanted to highlight this point. So
They'll come after you, your Aadhaar card, your permanent address, everything will be with them. They'll come after you. You will be like in a red alert area, because if you are coming out of the job, it's not only like you are coming out of a job. You are coming out of an area which will be having sensitive issues. So the nation is very particular about that, that no person should go out of it immediately. So police will come back to you.
Yeah.
To your...
I hope, I think, Kalyani, I think you got the answer.
Yes, sir.
Yeah. Thank you, Dr. Ravi.
Yes. Thank you.
Thank you, sir. My next question is again to Dr. Narasimha, sir. Sir, where were you initially posted, sir, after getting into a WHO? And what are the incentives you receive? And what is the order when you get promoted? Like, what is all this process about?
Just as a part of my earlier answer, probably I've initially stated it. I was initially posted as a national consultant under the country office, India. So my posting is for Tamil Nadu state in specific, and because of the ease of access, I was located at Chennai as my duty station. So Chennai being my major part of the stay overall for the period of that tenure which I worked with WHO, I am duty stationed at Chennai, but although I cover the length and breadth of Tamil Nadu. So that's like part and parcel of the job. Like I said, travel is an essential component of most of the public health jobs. Leave apart WHO, for any other public health profession also, you actually need to go out to the problem point, the problem location as such. That is one of the most important thing. And having spoken of the incentives, which I heard it right, if it is so, you do receive a sizable decent pack, and most often it is in no comparison with the rest of the contemporary organizations or the other professional cadres which we have. But then like we always have the standardized statement, if you're being offered, so you need to have the worth and capacities to have achieved that as a qualification or in credibilities to receive as a compensation. Because WHO as in also has to add a word to my previous panelist who spoke. WHO offers you a kind of very comfortable time frame, which works on a very professional note, Monday to Friday, most often 9 to 5 being the duty times, or the most often you're associated with the other government counterparts. So their office timings become your office timings, the NHM office or the state Ministry of Health, Family Welfare office. So it more or less it falls in tune with your government counterparts' office timelines, and the weekend is definitely a weekend. So it's a Saturday, Sunday off most often. Although you do have timeline issues because of the widespread working domain of the program or the organization as in general. It says World Health Organization, so the world is virtually connected now. It is easy at times, and it is also hard at times when you have to answer a call from Geneva, which falls about 2 o'clock in the afternoon and spreads over about 5 to 7 o'clock or something, and so on. Or you have some other colleague who's having to discuss something of importance from US or from West Indies or from Africa. Handling those calls and those meetings, which are very much essential and important, becomes a kind of an issue. Kiran, could you just remind me what was the third component of the question we were asking?
Regarding the course, like promotions, like how many years, like is there any particular tenure for that?
Yes, yeah. Thank you for that. But initially, the flow of professional cadres is different. Just as to give you an understanding, it doesn't go in a normal hierarchical pattern. If you look at the academic part, because most of this is for an MBBS post MBBS understanding, you have the assistant professor, you have the associate, you have the professor, and then you have the HOD and so on. So it doesn't actually work in that kind of a way. You're recruited under different designations, and you are in that designation for a time. The only hierarchical pattern which works is for the NPSP program. That's for National Polio Surveillance Program, where you join as a surveillance medical officer. Most often, surveillance medical officer, SMO, is the entry level point in WHO most commonly. Majority of the people, the fresh MBBS grads or people who have less than 2 years experience enter with that position. And if you are an SMO, you become a regional level surveillance medical officer. Then you become the sub-regional SRTL, which is called as, and then you become the regional team leader, RTL. And then you go to the national level position. So it's kind of a tier system, if you can understand it. It's the SMO, and then you have the regional and the sub-regional, and then you have the national level cadre. It's only for that particular domain. It works in that tier system of promotions, which is again based upon your competency skills, your expertise in solutions and problem solving, and also the tenure. It works on a 3-year basis. Otherwise, apart, most often, largely all other cadres, the NPO, the National Professional Officer, or the IPO, International Professional Officer, or the external consultants, or the other cadres which are there, of course, the Junior Professional Officer. These work as a biennial contract. WHO has that typical setup of you have a 2-year contract. So often your role or the job is given only for 2 years. They're very specific. Their ID cards are also issued only for a 2-year period. And then the contract renews depending upon the need. So there is hardly a scope of being a specific permanent member of an WHO, which is called staff cadre. So the staff cadre is the way ahead experienced people. You know, when you're sitting as a staff of WHO, it's like for people who are greater than 10 years and 15 years of experience, and they become the actual staff members. So that is a different category, which probably doesn't fit in our discussion point as of now, because having spoken of opportunities for MBBS and talking about 15 and plus years of experiences generally doesn't fit in. So it's usually the external consultants cadre which is more preferred, or the surveillance medical officer cadre, which is more preferred. And most often I've seen counterparts of my colleagues and other seniors colleagues of mine who actually get into surveillance medical officer, like you were referring to, because of the what you call attractive incentives. But then they usually run out of it, because the kind of workload they have as a surveillance medical officer is exhaustive. Trust me when I say that, because it is not just 1 or 2 districts. They're usually given assignment of about more than 5 districts to control, and across 5 or 6 districts of higher magnitude and a disease outbreak somewhere. Let's assume, for instance, now I'm in Visakhapatnam, and assume there is an outbreak in East Godavari district, which is about 250 kilometers away, and I have to travel right away and see what's the problem there. So this kind of becomes a little challenging and is a tough task to sustain. Of course, people with competencies and proficiencies do go again and stand on their own remarkable name and create certain benchmarks. Personally, I've been very closely associated with one of the SRTL of the Tamil Nadu and Chennai South Indian region, Dr. Arul Kumar sir. So he has done phenomenal work in the field of NPSP. So something like that, if you stand alone and sustain through the process, you definitely win across and go up the promotion ladder. Otherwise, apart, the best challenge would be as to go as an individual consultant or the NPO, which rolls on. Your duty is specific and you work on those domains.
Thank you so much, sir. It was very detailed. And
Kiran, I just wanted to add one more. I'm sorry for disturbing everyone. I think,
sure,
yeah. Actually, those who wanted to travel, like they can choose in this pharma physician. I'll tell you here the 2 aspects are there. One is a local, like the second one is a global safety officer, or the manager global safety physician. There are different designations, but here those who likes traveling, so they can travel, like today, this month in one country, the second month in another country or something, because you know that the financial the pharma companies are financially very, very sound, so they can able to sponsor you to one country to other country if you are a global safety officer. And similarly, for a medical manager, medical services, today you will be here in Chennai, tomorrow you may be at Bombay or Cochin or something. You'll be meeting top practitioners in the cities for the promoting of the drug. So those who likes traveling and all, so they can also select this pharmaceutical physician position. That's all. Yeah. Thank you for the time. And
thank you so much, sir. Over to Lekha.
Dr. Shaji, so since all the panelists highlighted the significance of weekends, would you like to throw light upon the lesser talked about challenges in this field of biomedicine, or do you think there are any consequences?
Okay, so a lot of biomedical companies follow the usual corporate culture. So I would say the companies that come for recruiting biomedical engineers, some of the companies like Philips Healthcare, Equia, Cure AI, they have a very fixed time schedule, like Monday to Friday, Saturday, Sunday, only if they have any work demands, etc. So it will be hectic. For juniors, it will be hectic at the beginning. Like you might have to put in the hours, but once you get the senior level managerial positions, or when you get to lead the team, it'll be a little more relaxed. So I would suggest that if you understand the corporate culture, it's literally the same in biomedical industries as well. But the good thing is that if you're actually interested in innovating, if you're interested in doing some impact, some making some difference in people's life, I would suggest, like every other, like my distinguished panel members said, every field has its opportunities. So if you think biomedical engineering is your thing, if it makes you exciting, if it makes you feel that you can innovate and do some difference in people's life, I mean, we are talking about millions of lives. Like for example, if you innovate a device at a pandemic's time, you are literally impacting millions and millions of lives, even not just in India, across the world. Also, there are a lot of entrepreneurship opportunities. Like if you're interested, you can start your own company. For example, if you made a device in your college for your project, if you think it's a viable business solution, you can take it. The government itself is very supportive of such student projects. Even entrepreneurship, if you want to scale up to a like a viable business, you get the funding, you get a lot of incubator support. There are a lot of biotech incubators across the country right now. So if you're looking to start up as an entrepreneur or as a founder of a company, this is the right time. When you're an entrepreneur, you decide the whole thing. Like you decide the whole lifestyle, you decide what the company will do, you decide how the team will function. So if you're the boss, you decide how your timings and schedules will be. But if someone else is the boss, yeah, by default they'll decide what your schedule is. But yeah, if biomedical industry as well follows the usual corporate culture. Yeah.
Thank you, sir. Thank you
Yeah,
for
added to Dr. Shaji, like one of my colleague, ex-colleague, like he was a physiologist. He was working for a sleep lab and all, sleep medicine. Now he was placed in the Philips company in Singapore. So the point is, it cannot be directly like a biomedical thing and all. You can be a that physiology or pulmonology or something. You can be connected to the sleep medicine, sleep lab, and all these things. So they're all different ways where you can connect it. And only thing is the curiosity. Yeah, thank you.
Thank you, sir.
Like this will be the last round for the panel discussion. Like I'll be very honored to ask Dr. Suptan this question. Very honored to interact with you, sir. Like what are the various opportunities we get in the field of digital health and health informatics? And also, like you can conclude by saying, like, what is your advice to all the medical students throughout the country as the senior most, sir?
Thank you, Sai. In fact, as I've been repeatedly saying, I mean, you have to really learn by doing. So I'll give an example, live example, in fact, how social networking works. When Sigma had actually posted that and had tagged Anup. So Anup immediately sent me a friend request on Facebook and we got connected, though we had not met yet face to face. And right now I posted a screenshot of this ongoing live session and he has commented there as well. So I as well left a comment in the YouTube live chat. I have left my email ID there. So it's not good enough that you have heard someone or saw someone. It's more important to keep in touch over the years. Just because you know you met someone today doesn't mean you are going to get a job from him or her tomorrow. That rarely happens. It's not that it doesn't happen. It can happen, but it's rare. In fact, I have even come across people whom I had met in a conference 25 years back, and now we are working together. So that sort of thing does happen. So this social networking, that's very, very important. And now it's a global village. So networking doesn't necessarily have to be in your geographical locality. You may be in Mumbai or Delhi or Hyderabad or wherever, but you can actually network with people all across the globe. And someone had said earlier, I mean, if you are interested in PhD, why PhD only in India? You can look at the best labs across the world, whether it's in the US, North America, or it's in Europe, wherever it is. You have to see what exactly they're working. Does it match with your interest? This introspection, that's very important. I mean, it's not just enough that you want to do something. Firstly, you have to love the thing you want to do, and also you have to be good at it. Just loving something and not being able to do well doesn't help. So both the things have to match. And when you look at those projects anywhere in the world, and you see somewhere someone is actually working on a field, something that you nearer to your heart, you can definitely do force applications. In fact, most of the jobs that I got were actually by forced applications, not against any advertised positions. So it does happen. It has happened with me so many times. So I know it as a personal experience. So you have to actually, like someone said, I mean, if opportunity doesn't knock at the door, you have to build the door. You have to be proactive. You have to go on doing things. So you have to learn how to learn, because whatever you learn in any educational institute would not be enough for the real world. You have to go on learning, lifelong learning. And the first part has to be unlearn the older concepts, the obsolete things. And then you have to go on connecting with people. One of the best ways of connecting with people, and especially for the MBBS students, now you have got this ICM or STS program. And a lot of you would have done that. And certainly it must have also been as a publication, or sorry, those who are doing your postgraduate dissertation. If you have not already published, do publish. Even based on the publication, you'll get lots of connections. In fact, one of my papers that was published in 2006, that has got more than, I think, 100 citations so far. And there I had cited a person who had actually done some work on it long time back in the 80s. And I was quite surprised to see that he had actually mailed me that I am happy that you are working on this, and I'd definitely love to work with you if possible. So that sort of thing does happen. Do the work you love and be good at it. Publish. If you work well and no one knows, it doesn't help. You can post in LinkedIn. You can post here. I mean, sometimes it may appear that not many people are reading. Why do you want many people to read? If the people who matter read, that's more than enough. So keep a positive approach, and you'll learn the hard way. I mean, life is the greatest teacher.
Thank you so much, sir. It was I'm privileged to talk with you. And thank you for blessing us with your presence, sir. Over to Rekha.
Dr. Vuchanani, one last question for you, sir.
Yes, please.
We completely appreciated your interjections throughout the panel discussion. So thank you so much for being an active panelist tonight.
Thank you.
So my last question for you, sir, is I'd like to know your comments on, or just what you think about the financial stability that comes with a job in this field of pharma. Like, what do you think? How is it beneficial financially?
Yeah. Before answering to this question, I wanted to ask from the organizers, what is the basic salary of a post MBBS doctor?
It's 20,000.
Any other figure?
30,000 basic. Some
30,000.
30,000. Yeah.
30.
Yeah, 30,000. I think this is very pathetic situation, or you can say that it is a fact everybody has to admit. But here in pharmaceutical physician, the starting salary will be of 1 lakh. It's a minimum. That depends upon, again, your experience. And if you have an experience only with the MBBS degree, that starting salary goes up to 5 lakhs per month. Here they'll count as a CTC. So all the facilities and all, the figure will be of 5 lakhs, but whatever you will be getting around some 3 lakhs and all. Okay. Another important thing is you have a lot of benefits where you don't get in other jobs. Let me explain. The first important benefit is you will get 10 to 15 lakhs of medical.
Sir, we lost you. Sir? Sir?
I think there's an internet problem.
I'm audible.
Yes, sir. Yes.
Yeah,
sir.
yeah, yeah.
We lost you.
That is one very important nowadays. The having of medical insurance, the corporate medical insurance will be given by the company. The third important thing is term policy. 70 to 80 lakhs of term insurance will be provided by the company. So this is the third important monetary benefit. The fourth important monetary benefit is they will provide you EPF, Employees Provident Fund. For example, they are taking, you are contributing 15,000 means they will contribute 15,000. So the 30,000 will be put it in the bank. So these are all the monetary benefits. And one more thing is you will not be abruptly terminated for anything. You will have a rules and regulations of 3 months and all. So if the company wants to remove you, they will inform you 3 months in advance. Otherwise, they will pay you 3 months salary in advance and vice versa. So I think monetary wise, this is a more secure and you need not to worry. But only thing is you should be willing to work, and that's all. That should be your choice of working. Yeah. I think I answered like.
Yes, sir, you did. So this is like a short measure to reimburse all the educational expenditure, I guess.
That's
which
correct.
is wonderful. But yes, thank you so
This,
much, sir.
yeah,
Thank
sure.
you so much for
Thank
your
you so
input,
much.
and thank you for
Thank you.
being with us tonight.
Yeah.
Over to you, ma'am.
Ketawat sir, how would be the work life of an armed medical corp in all the associated 3 sectors? Like as you said, Army, Navy, and Air Force.
Actually, one thing is I got an offer letter. I have cleared the interview and the physical fitness, but I have not joined armed forces because in my house they didn't agree. You first do a PG, then only whatever you want you can do after the 3rd year. After the 3 years, the passion will automatically decrease. You will more likely go into that clinician jobs and all. My PG degree is in emergency medicine. I did MD emergency medicine, and after DNB emergency medicine, I have never felt like guilt because I have not joined armed forces, because my regular work is equal to a soldier. I'll be running all tours, like everything, anything can happen in my department. We'll treat for the patient, anyone, anytime, any person. So I never felt guilty about that. So I cannot give the work life with my experience. So some of my friends are there in short service commission. Their regular duty is like a doctor at the base camps, mainly in the army. I'm mostly telling about army because 85% are the army jobs. So whenever a war comes, they have to go in the nearby area also, or otherwise they have to do the physical testing, clinic hours, and the training also. You have to be doing it with the soldiers. And coming to the salary and all, central government salary is according to the same pay, 7th pay and all. And you need not have to take any penny from your pocket to do anything. You will be provided a car, a driver, a servant, food, and even the money will be given to you for ironing of your clothes. So without spending anything, you can have a peaceful life for 5 years regarding to the money. But my sincere advice to the students that do not see only the money as a perspective. Do not see only the money or the insurance or the leaves or the liberality of any of the jobs. You should have passion, and for that passion, if one person, if you take like um, in SPM, like field work and all, I'm not at all interested going to a field, collecting the data, analyzing the data. It's not my kind of job. I cannot survive in community medicine at least for a day. So you have to choose your passion. Like you how will you know that these many opportunities are there? Means you have to keep your eyes wide. So if you have to search, continuously being in a well and continuously studying PG is not an option, because even though after getting PG, the salaries are not that much good. The respect in the present society is not that much great. So you have to choose your expertise, which department you belong, which kind of work you love to do. I'm passionate about my work because it became my profession. My passion became my profession. So I'm always happy and enthusiastic to work. So how will you find passion? Means you have to search various fields. Like if, for example, if PET Usha in her school, if there was no ground, she didn't run any time. So she don't know. She ran sometime and someone recognized she's running good, and then her career started. If you are not doing something which your passion is inside it, so you never go to that field. You will be like that regular MBBS doctor or a regular PG doctor. PG is like over glorified in India. Don't be coming after PG, and waste all your years. And a beautiful line from each of one of the experts said that you have to learn and unlearn. Not the strongest person or a weakest person. The person who can adapt will survive. This is how what I can now tell.
Thank you so much, sir.
Thank you so much, sir. So my last question to Dr. Narasimha Manoj, sir, it was very proud to interact with you. So like, if you wanted to quit in middle of our tenure, sir, like you said 2 years, if you wanted to quit in middle of that and you wanted to go, like what would be the procedure and your advice to all the medical students who are listening to you in this YouTube chat, in this live?
Let me begin with one very important advice, as in my own personal experience. Be honest to your internship. The internship is there for a reason, for you to practice and garner the clinical skills and the communication skills with the latest AdCom curriculum at it, the attitude, the ethical issues, and the way you interact with the patient or the person in general is of significant impact. One healing touch and one healing word has an personified impact on the healing component. Not just alone the drugs and the medical part is doing the job, but a compassionate physician is always a core component of the health system. So do be genuine to your internship period. This particularly suits for the interns who are listening or who would be interested in this particular session. Also, I'd like to congratulate and be grateful for the organizers for having chosen such an important topic, because like my diversified panel experts are speaking, most often the young minds are in a kind of a tunneled vision that I am in a competitive race to run after an MD or an MS right after I graduate from MBBS. Though the moment I'm out of my MBBS college, I have to sit in an MD or an MS seat is kind of a thought process we usually have. And I see most of the students starting with their coaching apps or the live sessions or the virtual sessions right from the second year and third year of MBBS. Instead of focusing on what the class is going on, they're focusing on far fourth carrot, which is looking at a post-graduation seat. So be at it during the process of your internship is the right time most often, where you actually try and have an understanding of what best suits you and where do you fit in your best. Because I strongly believe if you love the work you do, the best outcomes are obviously a follow through for it. So you will have a sense of idea where you are kind of interested in, or you kind of have your passion driven to it. So personally, I actually reflect and echo with Dr. Ketawat sir, because in my internship itself, I've appeared for the Mumbai board for the armed forces, and very well, like sir said, I was also one of them who cleared it. And then back then, for the other reasons, I didn't go ahead with that job. But then right after that, I realized that my passion lied in serving the community at a larger scale, and probably giving an impact of significant magnitude is where I would probably want. And then that led me into public health. So to answer your question in specific, the process is very simple. I'll give you my own personal experience. I was in a 2-year biannual contract for that national consultant position. And then so as to harbor and garner my skills, I gave it out at after completion of 1-year term. The process is pretty straightforward. The contracts beyond 1 year of tenure will require a 30-month notice period on either sides. If they want to terminate you, which is a nightmare kind of thing. Nobody would like to have a termination order from World Health Organization. So let's not talk about that part. If you would want to go ahead and for any reason you would want to drop out in the course of the tenure, that will be a 30-day notice period for a contract which is over 1 year. And for a contract which is less than 6 months, they do have short-term contracts also. That will be a 15-day period. Within my own personal experience, I worked for 1 year. Then I gave a terminated notice to the organization of a 30-day advance period. And then now I'm pretty much pursuing in my MD community medicine. I'm happy to have my guide as Dr. Vijaya Madam at NRI Institute of Medical Sciences, Visakhapatnam.
Thank you so much, sir.
Dr. Shaji, I've got one last question for you. Firstly, thank you so much for being here with us tonight. So my question for you is that, again, it's similar about financial stability that comes with a degree in this field, and also which place is preferable, like India or abroad, for a job in this field.
Okay. To be specific, the financial pay scale could range anywhere from 11 to 50 lakhs per annum for a fresh MTech clinical grad from an IIT. I would suggest that if you're really interested in MTech biomedical engineering, if you're not looking for an entrepreneurship kind of a route, even abroad options is very good, like US, Germany. They have a very good established biomedical domains there. In India, it's very niche. The government is trying their own ways to promote and to inculcate the different streams of entrepreneurship and different it's trying to make the ecosystem viable for the biotech companies to exist. But the situation is not that great. Even if you're a graduate of an IIT, doesn't mean that you can automatically get a job. It's kind of difficult, but the future there is a bright scope, because the government themselves can understand that from the COVID that the importance of biotechnology, biomedical innovation. So they're trying to promote in their own ways. So the future is bright, but at the moment, right now, the abroad option seems more interesting and inquisitive. If you are actually looking to, earn big money, but if you actually want to settle in India, serve for India, do things for, especially for rural India. I'm happy to notice that there are a lot of entrepreneurs, engineers, and doctors who are staying back in India to serve the rural community. It's a very, very noble thing. And if you actually feel that this is something that you want to do, India has enough and more opportunities for you guys to settle, to flourish, to become a big name. Just like Biocon, all of these companies have been started in India itself, and they grew to be the multi-billion-dollar businesses that they are. So I would suggest that if you really, really believe in your conviction, stay true to it, follow your passion, take risk. It's okay to fail. It's okay to not know. For example, all of the interns, most of the interns don't know. I understand that it's a very big tendency that we are at the moment right now, we don't know what to do. That we have a lot of interest, we have a lot of passion. There are a lot of career streams there. It's okay. You can take what you feel like. It's okay even if you don't like it. You can go to another stream. Nobody's gonna come behind you for it. You can take risk. Feel free to take risk, because most of the big people who have made differences have made a lot of taken a lot of risks. They failed, and that's how big people come up. They rise up from their failures. So it's okay to fail. It's okay to be confused. I would suggest, if you really want to do something, follow your passion, follow your heart. Rest, everything will work out. Things will fall in place. Just stay true to what you really want to do in life. Don't settle. Don't compromise your passion just to make money. If you really follow your passion, you can actually make a good career out of it, and you can actually earn money in the process. So all the best. Good luck to everyone. Yeah.
Thank you. Thank you so much, sir.
Thank you, everyone. Over to Lekha for the vote of thanks.
I would honestly don't have anything prepared, but I'd just earnestly like to thank each and every panelist here for having graced us with your presence and help us answer all these questions that we had regarding various opportunities. I think it's really interesting, and really thank you so much. Thank you for inspiring us, and all the very best for all of your ventures. Thank you, sir.
Thank you, sir. Thank you, each and every one of you, for making your time from your busy schedule, and you're ready for inspiring many students today, that you have shown that there is far better than MD and MS. There are many other fields to explore. Thank you.
We must also appreciate the organizers. You have really chosen a very diverse panel and made sure that there's no typical clinician offering the solution. So that, I think, is a very noble endeavor. I would have been happier if more people had actually seen the live session, but I hope it would be available. The recording would be there. So maybe make people aware, because I think people should really know.
Yes.
Because most of them are not even aware that so many things are possible. So I think I must appreciate you, and thanks for the opportunity, and wish all of you all the very best.
Thank you, sir. Thank you, everyone. Thank you so much.
Thank you, everyone. Yeah, I just want to conclude by saying cultivate the habit of empathy. Sympathy, everybody knows, but empathy part is missing for the upcoming branch. So I always suggest start practicing family physician. Family physician concept is very good for the post MBBS, and cultivate the habit of empathy. Thank you, one and all. Thank you, Dr. Simhachalam, for giving the opportunity.
Thank you, sir. Thank you, everyone.
Sir, we will end the session, sir. Thank you, sir.
Thank you all. Bye-bye.
Thank you.
Thank you, everyone.